Welcome to video 2 of our conversation about narrative care as a therapeutic approach to counseling in general and to Christian counseling in particular. I'm Dr. Johan Martin. I'm a clinical counselor and I specialize in chronic stress-related conditions and disorders. I'm author of the book Moving On from Chronic Stress to Sustainable Resilience. The aim of video 2 is to explain a few things about Christian counseling and biblical counseling, and where narrative care as a therapeutic approach fits into the picture. The first thing is that Christian counseling has to be more than Christians practicing as counselors. There are too many other counselors out there who are also kind and caring, even though they do not believe in the Creator God of the Bible and who do not adhere to biblical teaching and principles. The second thing is that biblical counseling has to be more than kind and caring biblical scholars sharing biblical wisdom with those struggling with existential, relational, and mental health issues. I came across too many well-meaning but quasi so-called counselors, having some but not all the features of either well-trained interpreters of biblical wisdom or of well-trained professional counselors. Bad theology in the hands of unsupervised individuals is a dangerous tool that may cause rather than alleviate pain and suffering. There is nothing wrong in principle with Christians practicing as professional counselors, eclectically using various counseling models and interventions at their convenience. But that does not make their counseling approach a Christian approach, does it? In fact, nowadays it is not even politically correct to identify as a Christian when you turn up as a counselor. The codes of ethics prescribed by most accreditation associations for professional counselors may expect from counselors to avoid any imposition of their own faith, spirituality, or religious practices while counseling vulnerable clients. At the same time, there's nothing wrong in principle with biblical scholars sharing relevant biblical wisdom with those struggling with mental health and other issues. But that does not make them experts in the field of counseling and mental health, does it? It also does not officially protect the vulnerable ones whom they share their wisdom with from unethical behavior and abuse of power. The question is, how do we bridge the gap between these two approaches? What if there were an approach that could actually bridge the gap? An approach worthy of being referred to as Christian counseling in its own right. I had been struggling with this million-dollar question at the back of my mind all along, since I started studying sociology and psychology as a BA undergraduate. I continued wrestling with this challenge while finishing a BTH degree in theology, and later also a MTH degree in practical theology. During that study, I focused my attention on researching the function of interaction in pastoral care. This study again urged me to sign up for a PhD degree in practical theology, focused on a family therapeutic approach to stress therapy. I registered as a professional counselor in 2003 and has obviously continuously been confronted with a tension between Christian counseling, biblical counseling, and staying registered and legally insured as a professional counselor over the last 20 years. Many of my clients specifically ask me whether I am a Christian counselor. Although I explain to them that I am. I always have to explain to them both my theological and counseling training and background and ethical boundaries. The ethical question whether to point my counselees to the necessity of faith in Christ Jesus unto salvation and sanctification as an essential part of both Christian and biblical counseling has always been under fierce debate in the professional counseling world. In the meantime, we experienced a boom in the area of neuroscience triggered by revolutionary developments in the area of nanotechnologies. Wow! A God-created microcosmos unfolded right before our eyes. This new information guided me towards the neurobiology of chronic stress. I realized that chronic stress is the one critical neurobiological factor that is always, in some way or another, involved in all effective therapeutic interventions. While researching this topic, I came across the branch of science that deals with aging and the problems of aged persons, gerontology. This is where I learned that chronic stress is actually nothing less than accelerated aging. I learned that two Canadian gerontologists started introducing so-called narrative medicine in their treatment of aging persons. And this is where I stumbled upon the concept narrative care, which actually means to honor the accuracy of the lived experience of a person receiving help. To honor the accuracy of the lived experience of a person receiving help. From other sources, I also learned that we should not confuse the emotional persuasiveness of a person's story with the accuracy of the person's lived experience or narrative. And this is how the penny dropped for me. I realized that the interaction between a person's narrative and his or her story carries therapeutic value in itself. I also realized that a person's speech behavior, including their spiritual speech behavior, may play a major role in how they age. It affects their neurobiological reaction to danger or potential danger, which again affects their physical, mental, social, and spiritual health and resilience. This is how narrative care came into existence as a therapeutic approach. I explained the step-by-step development of narrative care in my book, Moving On from Chronic Stress to Sustainable Resilience. In video 1, I mentioned that I developed narrative care as a therapeutic approach both to counseling in general and to Christian counseling in particular. I also mentioned that narrative care adheres to neurobiological, neuropsychotherapeutic, and biblical principles. I mentioned that narrative care deals specifically with chronic stress-related conditions and disorders experienced by those who feel anxious, scared, angry, irritated and unwell, lonely, bereaved or hopeless, controlled, guilty, ashamed, disregarded, betrayed, deprived, frustrated, financially insecure, overloaded and confused. If some of these insights or terms sound a bit unfamiliar or complicated, please do not worry. I know that I had to bring worlds together in narrative care as therapeutic approach, but I will explain all these terms and insights in detail in follow-up videos. I also have to mention at this point that narrative care is not the same as narrative therapy. Narrative therapy is a different but well-known therapeutic model which came from a totally different background and is based on a totally different theoretical foundation. Thank you for watching this video. In our next video 3, we will deal with emotions, chronic stress, and narrative care. Have a great day and remember to do the caring thing.